Hello, good morning or afternoon, depending on your time zone. Welcome. I am Dr. Joanne Yanez, and I am going to introduce Dr. Patricia Gaines shortly. But before we start our webinar, about 2 minutes or so, just want to go through some housekeeping. So hold tight, and we'll be starting in about 2 minutes. Looking forward to a great webinar. See you in a minute. Recording with you. And so with that, I turn over the screen to Dr. Patricia Gaines on the top herbs everybody needs to know about. So with that, Dr. Gaines.
Hi, can you hear me?
We sure can.
Great. Thank you so much for that nice introduction. I'm really glad to be able to host and deliver this webinar speaking about herbs, which is something I really enjoy to do. So I'm actually chair of Botanical Medicine, not nutrition, just Botanical Medicine. And I have some interesting background that I'm going to talk to you about. I'm going to talk to you about some herbs. I'm going to give some resources at the end, and hopefully we'll get to lots of questions also. So as Dr. Yanez said, I'm chair of Botanical Medicine at SCNM. I'm a naturopathic physician and a registered herbalist. I was asked to share my story a little bit, so I will tell you a little bit about me. Unlike many of you, I did not grow up exposed to alternative medicine. My experience with medicine actually from an early age was through the perspective of my father, who was a podiatrist and very conventionally trained. And whenever me or any of my siblings were sick, we were treated with an antibiotic. I always felt from a young age that there probably was more that could be done, but I didn't totally grasp that until I was older. I trained as a professional ballet dancer from a young age, and for anyone that trains for anything vigorous or is an athlete, you know that eating healthy and taking care of your body is really critical in order to excel and do well. So that was always important to me. But as I got older into my 20s, I started experiencing some health issues. I think the diet that I was eating wasn't appropriate for me, and I probably suffered from some really serious overtraining. So I ended up seeing an acupuncturist and received some really transformational care. She treated me and she worked with me on diet and nutrition. And after a short period of time, I started feeling much better. And that was really eye-opening to me because that wasn't my experience growing up of working with diet and nutrition at all to support wellness. I was always really interested in medicine, but I felt that there was a weird dichotomy that I couldn't bridge between being interested in health and medicine, but I didn't feel for me that my calling was to use medications as a major treatment for patients. So I'm going to come back around to connect that in a minute, but I read what I could. I was really passionate about herbs, and I think this was the beginning of my journey into herbal medicine and also nutrition. And when my dance career was over, I kind of was floundering, not sure which path to take and what direction to go. But I ended up meeting another person that was doing prerequisites to attend naturopathic medical school. I didn't know about it before that moment. And when I looked into it and found out what it was, I felt like, wow, that was the perfect alignment with the things I was really passionate about. Helping people on their journey towards health and wellness, and also using natural treatments like nutrition, diet, herbal medicine to support their wellness and as treatment. So this is my story. I ended up going to University of Anchorage, Alaska, and did prerequisites, which were pre-med prerequisites. It took me several years. I went to Bastyr, and in 2002, I graduated with my ND degree. I moved to Arizona for a 2-year family practice residency, but my focus during those years outside of that also encompassed women's health, homeopathy, and botanical medicine. And after that really rigorous 2 years of residency, which was great, I saw many patients and just had really great experiences. I was hired on as full-time faculty and eventually took over the chair of botanical medicine at SCNM. So currently I have a part-time practice through the medical center at SCNM in Tempe, Arizona. I also have a really interesting job as chair of botanical medicine. I get to teach our students, both in the classroom and the clinic, about using botanical medicine with patients. I teach botanical medicine classes. I've led some field studies. For the past 14 years, I've taken students to North Carolina to learn about plants there. And we also host a conference that I help organize. So I feel like my job is really interesting that way. Personally, I became a master gardener in Arizona to learn about gardening here because the weather is just so different. And I'm super passionate about healthy cooking. I also have some additional training in traditional Chinese medicine herbs, and just love treating patients and enjoying my job very much. So that is my story. And I wanted to lay a little bit of a foundation before we get into the herbs. So I use herbal medicine through the umbrella and perspective of my training as a naturopathic physician, which I feel is a little bit different than how herbalists use botanical medicine. So these are just some things I always keep in mind when treating patients. Always consider the whole person. So I think that intuitively makes sense, but what that means for me is the person that comes in may come in with a diagnosis or with some symptoms that they want addressed, but they are not the diagnosis, they are not the symptoms. They're a unique person sitting in front of me, and everyone has a unique expression and manifestation of a diagnosis or a symptom picture. And so it's really important that I understand both the person as well as what are their symptoms and what's their diagnosis. I assess their overall health in general, and that's through both questioning and getting records or ordering labs. I take a very detailed history. My experience with new patients is I'm probably going to be with them for an hour and a half, exploring their history, doing physical exam, etc. I'll get vitals. If they haven't come with labs that I need to review, in the state of Arizona, our scope's very broad, and I will order labs. I'll do physical exam. And then it would be really unusual for me to only treat patients using herbs, although certainly herbs are effective treatments and you can use herbs alone when treating patients. But because I'm a naturopath, I feel like my tool bag is really broad. And so in considering the whole person, I consider all these other elements that affect their health. And so I will ask and recommend interventions to help with diet, sleep, energy. Are they smokers? Do they drink excessive alcohol? Are they exercising? I would consider what medications and other supplements they're on, etc. So I think it's good to just note that first. And then before we launch into the herbs, there's a few things I just want to say about botanical medicine, because some of you may not have any experience using botanical medicine and have some concerns about botanical medicine in general. And what I would say is there's some safety in knowing that herbs have been around before people. And herbal medicine historically is the first medicine. Herbs have been around much longer than medications. And so that long history and legacy of herbal medicine being used lets us know that in general, herbs have a really good safety profile. People haven't been using herbs over time if they caused major health issues. Although there are a small subset of herbs that certainly we're concerned about due to safety or dose or interactions. And if you go to naturopathic medical school, that's something that you'll be trained about. Also, there's a lot to know about herbs because they're complex. They're not like medications where they're one substance. Herbs can have hundreds of different constituents or compounds in them. And so the way you give herbs to patients or how you decide to extract them takes knowledge, and you'll learn about that. For instance, some compounds are more water soluble and would be better delivered in a tea form versus some herbs which are better extracted with a higher percentage of alcohol, for instance, like herbs that contain resins. So that would be information that you would learn in naturopathic school. Generally, herbs are much more gentle and safer and work slowly over time compared to medications. And usually you dose herbs several times a day versus one time a day for best effects. Today's herbs that we're going to be talking about are herbs I chose that all support general health and wellness. They're considered tonic herbs, and we're going to talk about that. And one thing I just really love and drew me to botanical medicine in general is the healing potential of herbs, that they have the ability to not only treat, but they can improve your health and vitality. And I don't feel like medicines do that, but herbs have this amazing potential too. And I'm not saying that herbs don't have a really critical place in healthcare. They can be life-saving, but oftentimes the decision to use an herb over a medication is if the herb is capable of treating the condition and doesn't have side effects and is much safer, that would obviously always be my first choice. And then if I needed to prescribe a medication, I have that option and I would do that as well. Great, so let's launch into the herbs. Our first herb is Centella asiatica, and the common name is Gotu kola. You may know this herb. It comes from the Ayurvedic tradition. It's native to places like India, Asia, and the South Pacific, although it can grow here. It's a very low growing plant. It kind of makes like a ground cover because it spreads really easily. You could grow this if you had moist soil, and in Arizona we actually have it growing, but we have a shade cloth over it because just the intensity of the sun is so much, but it's quite an easy plant to grow. You can actually use this plant as food as well as medicine. The leaf is edible and you can eat the leaf, you can juice the leaf, and I'm going to talk about that a little bit. But if you want to make medicine out of Gotu kola, you would use the whole plant. You would use the leaf and the root. Now I'm going to go through this list of primary actions for each of the herbs we're talking about, and some of this may be new terminology. And I'm going to talk about the terminology a little here. And if you have a question about that, wait and see if the next few slides answer your question, because I'm going to talk about how to use each plant based on what those primary actions are. So the primary actions for Gotu kola are, it's an adaptogen. And this is an herb you're hearing more about. I feel like the media talks a lot about plants that are adaptogens, and you may know some other plants as adaptogens like ginseng, which is an adaptogen. But adaptogens support adrenal function. They improve energy and recovery. And so for people that have chronic stress, adaptogens can really help support and offset the effects of that stress. It is a nervine, which means it balances and supports the nervous system and overall has a calming effect. It is a venotonic. So the name veno refers to veins. Gotu kola has a special affinity for venous tissue, or the veins, and it can improve tone of veins. So for instance, venous insufficiency or varicose veins are two conditions where using a venotonic would be very helpful. It is nootropic, meaning it helps enhance and improve memory and concentration and focus. And it's a vulnerary, meaning it's a wound healer. So it heals wounds both topically on the skin and internally. All right, let's talk about how you would use this plant and when it's appropriate. So my general feeling about Gotu kola is it really brings a sense of calm and focused when people feel frazzled and anxious or are under chronic stress. It really helps relax and improves people's ability to focus. And sometimes when people are stressed chronically, they can feel fatigued and at the same time also be restless and anxious. And that picture is a good fit for when I think Gotu kola can be very helpful. Again, it has affinity to venous tissues. So for people that have hemorrhoids or venous insufficiency, meaning their venous tone is poor, and they can get lower leg edema, swelling, or varicose veins, Gotu kola really helps improve the tone of veins. PUD stands for peptic ulcer disease, so you can have a gastric or duodenal ulcer, and Gotu kola helps improve cross-linking of connective tissue, so it can help speed up healing of ulcers. and wounds in general. As I said, both internal, like an ulcer would be an internal wound, or a stasis ulcer, which is a wound topically on the skin, which is very slow healing, and outcomes improve if you use Gotu kola. So there's some conflicting information about safety related to isolated constituent research in animal studies, but we haven't seen that in humans. So I would say in general, I would avoid using Gotu kola in the first trimester of pregnancy and limit use throughout pregnancy. It's not really a pregnancy herb, although it's considered very safe in breastfeeding. All right, how would you deliver Gotu kola? So if you had access to Gotu kola that's organic, so that may be that you yourself were growing it and can collect the leaf, and you knew it was growing in an area where it wasn't planted near the road or in contaminated soils, it's really easy, and a great way to take it is to make a juice out of the leaf. You can juice it. It does taste kind of bitter, so I would add in something to balance and offset that, like maybe some pear or some apple and some ginger, and I think that would be a delicious way to take it. And then you'd be just juicing the leaf. You could make tea from the dried plant, or you could take capsules. Personally, I think the best way to get the full medicine of Gotu kola, though, is taking the tincture or the glycerate. So tinctures are a combination of water and alcohol extracts of herbs. Someone would have to prepare and make a tincture. Or a glycerate, which is using glycerin to extract the medicine from a plant. So glycerin tastes sweet. It improves the flavor of the medicine that you're taking, or you could take a tincture. Those would be things that you could usually purchase at a natural health food store or an herb store, or from your naturopath or herbalist if you see one. Also, Gotu kola sometimes is used topically for improving healing of wounds, and you can purchase things like creams that have Gotu kola in it for that reason. Let me see if I have anything else to add that I wanted to say about this plant. Before I go to chamomile, I'll just say one more thing about Gotu kola, which is sometimes I use plants as singles, but more often I combine them. And if you're thinking about using Gotu kola for its effect to enhance memory and concentration, I think it pairs especially nicely with a couple other herbs like rhodiola, bacopa, rosemary, or melissa. And a combination with any of those, I think, would actually probably enhance the effectiveness of Gotu kola. Great. Our next plant is Matricaria. So either Matricaria recutita or Matricaria chamomilla. Those are both names for chamomile. And what you're seeing is this beautiful picture of chamomile flowers. The flower looks like a daisy. It has each flower head itself actually is made up of many flowers. It has these ray flowers along the outside that are the white petals, and then it has these tubular yellow flowers which are in the middle. So each flower itself actually is many flowers. And that's characteristic of this plant family, which is called Asteraceae. The word chamomile actually translates from the Greek. It roughly translates to ground apple, which refers to the fact that it's low growing or close to the ground, and apple referring to this apple-like scent that the fresh flower has. So if you ever have a chance to smell it, you might note that too. So the flower is the part used, and these are the primary actions for chamomile. It is a nervine, so again, it helps support the nervous system and has an overall calming effect. It is anxiolytic, and what that means is it decreases anxiety. It is a hypnotic. Hypnotics help you fall asleep, so it's something you would take in the evening before bed, and it promotes relaxation to help you sleep. It's pretty substantially anti-inflammatory, so it modulates inflammation. It is a spasmolytic. Sometimes we call that anti-spasmodic. And I'm going to pair that with the next word, which is carminative. So plants that are anti-spasmodic or carminative help dispel gas and bloating from the GI tract, and they overall relax the abdomen and the gut. This is another plant that's a vulnerary or wound healer, again, for both topical or internal wounds, and it's a diaphoretic. So if you drink a hot cup of chamomile tea early on when you have a cold or flu, it can really help speed along the process of getting better. And so those are diaphoretic herbs that do that. So it'll help promote sweating. Matricary is native to Europe and parts of Asia, but this is a really easy plant to grow. I enjoyed growing it last year in my garden, and when it was blooming, every day I would go out and pick the fresh flowers. And there's a lot of volatile oils in this plant. It has a really intensely volatile, great smell to it. And when you make a fresh cup of chamomile tea, you really get that. Okay. This is a pretty common plant. You probably could go to any grocery store in the tea aisle and find tea bags of chamomile. We're going to talk about quality and delivery in a little bit. So probably most of you have tried this plant, and people drink it for medicine or take it for medicine, but also just as a beverage tea because it tastes really nice and is really mild. It's a plant we often use with children because of its gentle healing properties. So it is helpful for insomnia, so inability to fall or stay asleep. And what I'd say about chamomile is it doesn't do this through sedating you like sleep medications do. And I have full confidence that if you take chamomile in the evening, it doesn't make you feel groggy or hungover when you wake up the next day. It just gently relaxes people so they can fall asleep. And it's helpful for this this sense of being irritable or restless or anxious because it's gently calming and it's a nervine. It helps support the nervous system. So I'd say it's probably not the strongest herb in terms of you would take it once and all those symptoms would resolve, but you may notice over time that you're more capable of managing your anxiety or you're less irritable when you take chamomile. And you can take chamomile during the day to help calm you, or you could take it in the evening to help with sleep. Now, one very specific use for chamomile is with teething. So imagine an infant that's just getting a new tooth that's cutting through the gum. Well, there's a lot of pain and irritation involved in that, and babies often don't feel very good when they're teething. And so chamomile is really specific for treating the pain and irritation of teething. And my recommendation there would be make a cup of chamomile tea, soak some gauze pads in that tea, roll them up, put them in a Ziploc bag, and throw them in the freezer. And then whenever you need to pull one out for the infant, pull it out, take the gauze pad, and then the infant can chew on that chamomile-infused gauze pad. And it's a gentle anodyne, meaning it's a gentle pain reliever, as well as decreasing inflammation and calming the infant. And it's a really great treatment for teething. As I already said, it helps relax the gut and dispel gas and bloating, and specifically for a condition like irritable bowel syndrome or IBS, it can be helpful when there's lots of abdominal cramping. And you can just take the tea or the tincture of chamomile for that. It has another special action that it helps early on with wound healing because it promotes the formulation of something called granulation tissue. So again, for internal GI ulcers like a duodenal or gastric ulcer, and also for ulcerative colitis, those would be conditions that I think would really benefit from using chamomile. So safety, because it's a strong antispasmodic, it's better avoided in first trimester of pregnancy, but after that it can be used, and it's safe in lactation. There's so many uses for chamomile. Personally, I found this to be really helpful. It tastes very mild and has a really gentle effect, and people tend to really like the way chamomile tastes. Delivery of chamomile. Okay, so if you grow it or have access to fresh, it makes the most delicious tea. But you can use the dried flowers. And what I'd recommend is if you're buying pre-made tea bags, like you go to the store and buy a box of chamomile tea, the chamomile should look close in color to what chamomile should look like. So it shouldn't be gray and fuzzy and have no vitality, it should look pretty close to what a chamomile flower looks like. And if you want a medicinal tea, you at least should use 2 bags of that tea bag so that you can make it strong enough to have a medicinal effect. You can also take chamomile as a tincture or again as a glycerate. Glycerates taste a little sweeter. The tea to me tastes much better than the tincture. I think the tincture draws out some other compounds and it's not quite as pleasant tasting. But the glycerate certainly tastes good and is much sweeter. Or you can use chamomile topically. One great way to use it is to take a warm bath and put about 5 drops or so of the essential oil of chamomile. You can lay in the bath, relaxing, and then smelling those great volatile oils from the plant, which also help relax you. A wash is when you'd make a tea and then soak a cloth in that tea, and then use that to help wash, cleanse, like a superficial wound, to help that heal a little quicker. Infused oils are oils made from chamomile that could be used topically for something like eczema or psoriasis to decrease inflammation. You can purchase that or make that yourself, or a cream of chamomile, again, for itchy, irritated skin conditions. I'm going to take a quick drink of water. Okay, Crataegus, also known as hawthorn. So there's this SPP after Crataegus, that's Crataegus sp, or species. There are many species of Crataegus that are medicinal. So to shortcut listing many of them, the way it's often written is Crataegus species, also known as the common name hawthorn. This is a beautiful tree if you've ever seen it. It has gorgeous red berries when it's ripe. The part used is the berry, the leaf, and the flower, or some combination of those 3 for medicine. The primary actions are cardiovascular tonic. So that means hawthorn supports both the heart and the blood vessels to improve tone and function, and we're going to talk about that. It is hypotensive, hypo meaning decreasing, so it decreases blood pressure. So it is used often and commonly to treat high blood pressure, and we'll talk about that. And there are important compounds in hawthorn that are antioxidant. It contains bioflavonoids and a compound called proanthocyanidins, and those are important antioxidant compounds that in this case have an affinity to the heart and the cardiovascular system in general. Okay, why would you use it? Hawthorn is really great for mild to moderate hypertension. So I'd say if blood pressure is around the 150s over like the 80s, then hawthorn could be a good place to start. If blood pressure is much higher, then I think you're going to need more, you're going to need stronger herbs or maybe even medications, and certainly looking at diet and lifestyle to help support bringing blood pressure down. Angina is a condition where there's decreased blood flow to the heart and patients experience chest pain, and hawthorn's very specific for that. One thing hawthorn does is it actually helps relax and vasodilate the coronary arteries, which are the arteries that supply blood to the heart. And so by doing so, it improves blood flow to the heart, and blood brings with it nutrients. And so some people consider hawthorn actually food for the heart, referring to its ability to bring nutrition and blood flow to the heart muscle itself. And that's really helpful for conditions like angina or palpitations. Also, CAD stands for coronary artery disease, and hawthorn is used for that. Consider hawthorn's really gentle and slow acting. Patients should give hawthorn at least 3 months before really evaluating the full effect of the plant, because it can take a long time to get the full benefits of using hawthorn. Already talked about its really important antioxidant protection to the heart and to blood vessels. And overall, I'd say it really does improve cardiovascular function. My sense about hawthorn is anyone could really benefit that is an older person, like over 60, people could just take hawthorn because it's so beneficial to the heart. And if you imagine a lifetime of wear and tear from your heart beating and blood vessels, especially if someone does have hypertension. It's a good idea to take something that is an antioxidant to help cut down on free radical damage. Oftentimes I'll use Hawthorn just as adjunctive support. So maybe I'm using something stronger and a patient needs a medication for blood pressure. I'll also add in Hawthorn because I think not only do they need to lower their blood pressure, I just love the idea of providing antioxidants broadly to the heart and blood vessels. And then this last point has to do with the energetic heart, where emotions are stored in the heart. And if you experience a loss or grief, sometimes that can actually feel like pain in your heart. And it's nothing that's wrong with your heart muscle, but that's your experience, is that your heart feels broken. And I have certainly used Hawthorn to help energetically heal that broken heart. Safety. It's a berry, so you can also use a leaf and flower, but it's considered safe in pregnancy and lactation. Digoxin is a medication that's used for congestive heart failure, and Hawthorn also is used for mild congestive heart failure. So I'd say that interaction is what I'd consider a positive interaction. If patients are on digoxin and want to add Hawthorn, they should check with their physician. But when they're used together, oftentimes the patient can take less of the digoxin, and taking less medication to manage a condition is usually always beneficial to the patient. So that's a positive interaction where it's using Hawthorn actually supports the effect of the medication they're on. Okay, in terms of delivery, my favorite way for patients to take Hawthorn is what's called a solid extract. That's a concentrated extract of Hawthorn. It's kind of like a syrup consistency. It tastes good. You literally can lick it off a spoon, or sometimes I have patients use Hawthorn like a jam and they spread it on toast and they can just eat that. They can also take a tincture or make a tea from Hawthorn, but those are less diluted. So if a patient, for instance, you're treating with mild to moderate blood pressure and you want to use Hawthorn, I would recommend using the solid extract. But all of those deliveries can be effective. And before I go too far, I do want to give a recommendation that if someone is experiencing grief and you feel like you want to do something to support that, Hawthorn is a great herb, but adding in a few other herbs may be helpful, like rose or rose glycer. It's really delicious. And then also Avena sativa, which is oat, milky oat seed, which is something you can purchase extracted. Those three together are really good for helping heal from loss and grief. Okay, I hope I'm doing okay for time. Our last plant is Urtica dioica, or stinging nettle. Something you're not seeing in this picture is that this plant is covered with these stinging hairs. So it is true to the name, if you rub up against stinging nettle, it will sting you. And it's a little bit unpleasant. It's a weed. It tends to grow in stands, which are like large clumps. So you don't usually see one nettle growing by itself. They tend to cluster together. So if you're lucky enough to be in a place where it does grow, this is like the wild food that people can harvest. Arizona, it's too hot. It doesn't really grow where I live, but it grows in lots of other places and you can plant it too. Okay, so stinging nettle. The part used we're going to talk about is the leaf, although there are other medicinal parts of this plant. So today we're just going to talk about the leaf. And the primary actions are inflammation modulating, anti-allergic. Nutritive refers to the very high mineral content in the plant, and on the next slide I'll break that down. It's a diuretic, so it increases excretion of urine and can help do something which I call drain damp. And so if your body has a lot of edema or swelling, it can help reduce that through that diuretic action. And it's an alterative, which means it helps improve removal of waste products. So it's a detox plant. Okay, stinging nettle is probably, without a doubt, most famous for its effects at decreasing allergic symptoms. And so my experience is that if you have seasonal allergies, you will do much better if you start taking stinging nettle ahead of those seasonal allergies. So for me, I'm allergic to some of the native trees that bloom here in the spring. And about a month before, I start taking stinging nettle. And so when the trees bloom, I'm better capable of handling it, and my symptoms are much less severe. So any of these conditions, allergies, hay fever, hives, or rhinitis, respond usually very well to stinging nettle. And if you don't catch things ahead of the season, for instance, you don't always know when you're going to have allergies, you can use stinging nettle at any time. But like I said, for seasonal allergies, getting ahead of it is most helpful. Now, I would use stinging nettle by itself for allergies, but for all of these conditions, I would add in other herbs, but I think stinging nettle is certainly helpful. So gout is a condition where there's a buildup of uric acid and crystals form and deposit in a joint. This is sudden, it's very painful, there's a lot of swelling and redness. You don't want to have gout, but stinging nettle isn't an herb that helps with the pain when you have gout, but it can be used preventatively for people that get gout to help with excretion of uric acid. Eczema and psoriasis are chronic, scaly, itchy, inflammatory skin conditions, and nettles can be helpful, taken internally to help elimination of waste and decrease inflammation. It drains, it is diuretic, so it helps to decrease edema in joints. It's not the only plant I certainly would use, and I don't think it's directly helpful for joint pain, but sometimes joint swelling can lead to joint pain, and so it can be used in conjunction with other herbs to help with that. And it's a general alterative specifically for the kidneys. It really does help improve clearance of waste through the kidneys. Some other herbs I might think about using in combination with nettles for allergies include an herb called feverfew and the spice turmeric. Both of those also are very anti-inflammatory, and all three of those would be really helpful. So these are the minerals that nettles is particularly high in. Those abbreviations stand for calcium, potassium, magnesium, iron, and silica. Some specific conditions where that would be helpful would be for patients that have malabsorption and really need those nutrients, iron deficiency anemia because this is a plant that contains iron, or bone health because of the silica and the calcium. Now, if you want to extract minerals from stinging nettle leaf, you would need to do what's called a long infusion. And so you would get nettles, pour boiling water over it, let it sit, probably a tablespoon, by the way, of dried nettles per cup. Let it sit for like 8 hours and then pour off the liquid, and then you could drink that during the day. And then that should successfully have extracted the minerals because those are water soluble, and then you made a tea, which is water. This plant is a food. You can literally eat it as a green, just like you eat Swiss chard or kale. So it's very safe. It's safe in pregnancy and lactation. One of my favorite ways to make nettles, if you have access to fresh nettles, is a stir fry. Stir fry onions and garlic and olive oil, add in the stinging nettle leaf, let it cook for at least 15 minutes. Finish it off with some olive oil, salt, and a squeeze of lemon, and it's just really delicious. And so you can eat your food as medicine. It's really great thrown into stews and soups. You can just add in a really big handful, and it cooks down and adds a lot of nutrition. You can make a tea if you purchase it dry, like I said, and do a long infusion. Or if you have fresh nettle, you want to simmer it. So I don't recommend that people try eating fresh nettle leaf. Those stinging hairs will sting your throat and your mouth, and that's extremely unpleasant. But those stinging hairs break down if you cook the plant, or you make a tea out of it. So if you have the fresh leaf and you want to make tea, go ahead and pour water over that and simmer it for at least 15 minutes. Longer if you want to. The longer you make it, the darker and more minerals it extracts. Pour off the water and then drink that. You can also take freeze-dried capsules or tincture, and all of those are effective. Okay, I'm going to talk a little fast because I feel like I'm running out of time. Okay, we have a case study. This is a 48-year-old female with a history of seasonal allergies and sinusitis. Every year she has these. She's gone through rounds of needing allergy medication and steroids. She has side effects from her medications and doesn't feel well on them and wants an alternative, so she came to see me. She has no other significant health history. She's allergic to some of the native trees. She can't avoid them. She's not taking any medications or supplements. vitals and physical exam were normal, and she brought in blood work that also was normal. Her diet is SAD, or Standard American Diet, so lots of processed foods, low in whole grains, or really almost any vegetables. Her water intake's low. She's constipated, so she has a bowel movement every few days, and notes that eating dairy causes her GI symptoms like gas and bloating, but she does eat a lot of dairy. So I did a lot of motivational interviewing to help her agree for a period of time to try eliminating dairy, increasing water, increasing vegetables in her diet, and trying to eat a more whole foods diet. And then I only gave her two things: nettle leaf freeze-dried capsules, 2 grams twice a day, and fish oils, 2 grams twice a day. And then in 4 weeks, she came back. She just noted overall, she just felt much better. Her energy was better. Her digestion was better when she avoids dairy. All her GI symptoms seem to improve. She's now having most often daily bowel movements, and her seasonal allergy symptoms this year have been much better. She hasn't needed the medications, and when she does have allergy symptoms like nasal congestion, it's probably only about a quarter of the time, but it's less intense, and she feels like she can manage it without the medications. So she was really pleased with that result, and that's a great illustration of a patient being compliant and trying all these things using herbs and also naturopathic medicine to have a positive outcome. So hope I have a little time to talk about this. I was asked to talk about why naturopathic medicine. So for me, I feel like naturopathic medicine perfectly aligns with what I believe to be true about health and healing. I can't imagine what I'd do if I weren't a naturopath, and I really love working with patients one-on-one to understand them as individuals, to individualize treatment plans, and to really work with them to achieve their personal health goals, as well as using natural things to treat disease, and then empower patients through education about just how to improve the health of them and their family. For me, my focus and passion is botanical medicine, and I've spent the last decade gaining expertise in this area, doing a lot of additional continuing education, going to conferences. I've become a registered herbalist, and I feel for me it's really improved patient outcomes to have specific expertise in one treatment modality. And it also opens up many professional opportunities for speaking and writing and potentially presenting at conferences if that's something that you want to do. So what I'd say is, for every person that does naturopathic medicine, your affinity for what you want to treat and what kinds of treatments you want to use is different. And that's something that, if you're thinking about coming to school, you can certainly explore further. For me, my future plans are really tied with the school because I'm full-time faculty. And so we are expanding research opportunities at the school, and research is going to collaborate more with botanical medicine so that we're growing plants that will be used in research studies. And just in general, our plan is to expand the medicinal garden at the school and start planting some vegetables which can be harvested and used in our teaching classes and integrated into the nutrition curriculum. So I think that's really exciting, and I think all of those things are going to expand learning opportunities for students and probably open up selectives related to gardening and growing medicinal plants. So my advice for prospective students, although I've had a little more time to think about this, one is be open. This process is really exciting to go to naturopathic school. You're there to learn, and so even though you have your own experiences, which are super valuable for you as a physician, as a student, be open to all the new opportunities to learn that will come your way, because you don't know. You may never have thought about, for instance, treating peds, but when you treat pediatric patients, you might find that this is really something you love doing and want to do in your practice. So I'd say just be open to those experiences. And you're entering a profession where health and wellness is a key component. And so for you as a student, it's a rigorous program, but it's important for you to find your own balance. And so you need to do your own healthcare and not neglect that, because that's really important too, and will make you a better physician and better able to treat patients. So this is my contact information, although I'm going to open for questions in a minute. And then I've added a resource page, which if you want to learn more, I think could be helpful. I'll just say a couple things about these. So the American Herbalist Guild is the association for herbal practitioners. They put on an annual conference, a journal publication. They have great educational resources, and you can join as a student. You get a student rate for the conference and have access to many, many educational resources. The American Botanical Council is an organization whose mission is to provide accurate herbal information to herbalists, public, and industry. They also do a journal article and have many resources, including a searchable database, which is really great. The United Plant Savers is an organization promoting conservation of medicinal plants and plant habitats. They have a list of at-risk plants and many other resources, and that's a really great organization. And then if you're interested in herbal conferences, I would recommend you check out the folks at botanicalmedicine.org. They organize 2 herbal medicine conferences, the conference in Arizona at the school, which is the Southwest Conference on Botanical Medicine. And in North Carolina, they organize the Medicines from the Earth Conference. Both of them are great conferences. That website lets you speak, you can search decades of speakers at these conferences by topic or speaker name. So it's a really great resource. And then one more thing I would say is find a local herb store or herbalist to see if you can participate in some herb walks. Plants grow outside, and you learn best by having experiences with plants. So get out there and enjoy being outside so you can learn more about plants and their native environment. I hope this was really helpful. I'm going to open my mic back up to Dr. Yanez and see if you have any questions.
Sure. So thank you so much, Dr. Gaines. That was really wonderful. Would you mind just going to the next slide real quick so that I can just speak briefly about the upcoming events? Thank you. So next month, we are hosting a webinar on suicide prevention and naturopathic management of depression and anxiety. After that, we'll be talking about diabetes, and then in November we'll have our naturopathic medicine virtual fair where you can speak to representatives from all of the colleges from the comfort of your home. So with that, I again thank you, Dr. Gaines, so much. I have a bunch of questions here, so if we can try and keep the answers as succinct as possible so I can get to as many of them as I can. So the first question that had come in actually at the beginning of the talk was just in general, how do you know how to get good quality herbs and supplements? What would be some recommendations that you could make there for safety and making sure that you're getting quality supplementation?
Okay, that's a great question, and that's an issue for consumers who don't know. I have no association with these companies, but bulk herb you can get at a local herb store for sure, or from your naturopath or an herbalist to ask them about that. But if you are ordering herb, Mountain Rose Herbs and Pacific Botanicals have great wildcrafted and organic sources of bulk herb, and you can get those online. You also can go to the health food store, and companies like Gaia Herbs and Wise Woman are good companies that do testing. Companies are proud of the testing they do. You can look online at those companies and they'll talk about the testing that they do so you can see that you know you're getting really good quality herbs.
Fabulous. Thank you so much. Can you just provide a little bit of information on the workshop in North Carolina?
Yeah, I don't know if that's going to continue, but up until now, probably for the last, I think 14 years, through SCNM, we've had a selective that I've taken students on a field study to North Carolina, and we stay there for 5 days in conjunction with Gaia Herbs. And we learn about the local plants in North Carolina. It's an extremely biodiverse area. It's around Brevard. And also several days at Gaia talking about the herbs they grow, how to clinically use them, a lot of information about energetics and when herbs are specific for different types of patient presentations. it's really great. And like I said, I think doing field studies, spending time with plants is probably the best way to learn about herbs. So I really recommend people do field study, find out what's happening local in your area so you can learn about the herbs around you.
Great, thank you. So there were a few questions. Your broken heart herb talk really got folks interested. Can you just repeat again the three herbs that you indicated for broken heart, as well as maybe some stronger botanicals for cardiovascular disease and hypertension?
Okay, so I think the herbs I mentioned for broken heart, I don't know if I said this, I think I did, but Hawthorn is in the rose family, and I think of rose as having a real affinity to the heart. So Hawthorn in combination with rose, which you can get as a glycerate, and also milky oat seed, which is the immature seed of Avena sativa, which is oat. And before that seed develops into mature oat, it goes through this milking stage, and you can purchase that as a tincture or a glycerate. It'll be called milky oat seed. And that three herb combination, I think, is really great. And I think that's a real thing, that people feel like they have a broken heart, that they experience emotional pain in their heart, and that those things can be helpful. And I'm sorry, the other question was for higher blood pressure, what would I recommend? I would say if your blood pressure is higher, or a patient's blood pressure is higher than 150s over 80s, you really need to be evaluated and see someone for that. There are many reasons why patients have high blood pressure, and those are going to be stronger herbs, or they may need a medication. So I'd recommend really they see someone. And then there's all kinds of other diet lifestyle factors which people can work on, like improving diet, decreasing salt, managing their stress, and all of those things also certainly help with blood pressure.
Thank you so much. Can you speak about how you learn regarding contraindications for botanical medicine with things like aspirin? I know you mentioned digoxin on one, but where that information is available?
You literally could just Google herb medication interactions, and there's databases that you can check those through. However, if you're on medications and want to start herbs, you probably should see a professional that can help guide you with that. If you're a patient, if you're a student, that's something that you certainly learn about in naturopathic medical school, in your botanical materia medical classes. And safety is a primary concern, because of course you never want to recommend something that's going to be dangerous for the patient. So, you could just check those things online, but really, if you're on medications, you should be seeing a professional that has experience and can help guide you through that process.
Thank you. Here's a good question. I hope this doesn't put you on the spot too much, but since you do have both the registered herbalist training as well as a doctor in naturopathic medicine, can you speak to the difference in studying naturopathic medicine versus botanical medicine?
Well, I'd say one big difference is the way that naturopathic medicine is licensed, that I've had to pass really rigorous board exams, as well as graduate from a school with meeting certified training standards. So when I see a patient, I have to do standard of care. I'm never going to see a patient and say, I'm going to treat you and not do what I think is appropriate medical care to get to a diagnosis, so that I know exactly what's going on and can treat you. And I feel like that added level of responsibility really enhances my ability to treat patients and have good patient outcomes. Not to say that you can't have great patient outcomes using herbal medicine, but herbalists are not naturopathic physicians. They don't order labs and they can't diagnose. So they can treat without that piece. And so really that piece of information is so critical. For example, if someone comes in with fatigue, I could give them herbs that improve energy, but what I don't know is maybe they have iron deficiency anemia, and I really need to address their heavy menstrual cycle and improve that and give them iron. I would never have uncovered that. Or maybe they have hypothyroidism and I need to work on supporting their thyroid health. So you see that it's really important to get to a diagnosis in order to effectively treat the patient. And I feel like being a naturopathic physician gives me training to understand the patient as a whole person, but also to do the added steps so that I can really understand and diagnose them.
Thank you so much. So you have sparked the interest of some gardeners, and I know that your comment about chamomile and some of the other botanicals said, hey, if you can grow this yourself, that's always great. Do you have any resources easily available for folks who are interested in getting started on growing some of their own plants and herbs?
Yeah, actually, the Master Gardener Association is a great place to start. I know for me, when I moved to Arizona, the planting times are really different than the rest of the country. And so the Master Gardeners Association in your area should publish what's called a planting guide. You can look that up online. So for me, like I would Google Arizona Master Gardener Planting Guide, and it comes up with a list of herbs and vegetables and when to plant them, which is great because if you don't know that, I think you just won't be successful. There's also, off the top of my head, I'm not in the room where my books are, be able to pull that out, but there are lots of books on growing medicinal herbs. And you could look into that to find out more. But many of these herbs are really easy to grow. And it's fun to grow them yourself. If you have children, it's a great way to introduce them into gardening. And it's really fun to harvest your own herbs and use them. Like chamomile makes such a great fresh tea. It's just way better than anything you would ever get dried. So that's fun to do.
Well, you've inspired me to try and grow it now. I can say that much. uh, there is a question here. Do you have any of your study materials, or have you written any books that the students would be able to access without becoming a student of yours at SCNM?
No, I've not written any books. All my material, I mean, I've certainly revised all of the curriculum in the Botanical Medicine program at the college. But what I would say is there's never been a better time for learning about botanical medicine. There's just been such a resurgence and energy about using natural treatments. I think people want that. And so there are many good resources. For instance, if you have any interest in making medicine, Rosemary Gladstar is an herbalist that has been around for decades, and she has written many books. And so she's written books on medicine making and basic use of herbs. Also, Michael Moore, Moore, not the movie maker, but the herbalist, has written several different books on herbs. There's just really countless resources on herbal medicine. Mary Bove has written books on childcare and herbs in pregnancy. So there's no end to the resources available.
Well, thank you so very much for your time. I know that we're right about at time right now. And so with that, I'm going to conclude the webinar. I will stay on and answer a couple additional questions for folks who have additional questions after the webinar. So I will stay on and tackle a few of these questions. For any further questions, Dr. Gaines provided her information earlier. You can also feel free to contact info@AANMC.org with any questions that you may have related to joining Naturopathic Medical School. And with that, I am going to conclude our webinar. Dr. Gaines, thank you so very much for spending an hour with us. And this was extremely helpful. And I know that folks will really appreciate the recording available as well. So thank you again for your time. And I appreciate all of your attention and care for today.
Thank you. Bye-bye.
Thank you.